had nasal surgery in the past and wanted to make some changes in the nose, so we're able to do filler rhinoplasty. And the benefit is we want to avoid surgery. He's had some issues with breathing in the past, and what I found with our filler rhinoplasty patients is when we build up that nasal dorsum, it can make the breathing a little bit easier. If we're not happy with filler rhinoplasty, we can always go to surgery, but we found with filler rhinoplasty, we can avoid surgery and patients are very happy. So, any questions? We had a good discussion before. Any questions I can answer before we get started?
No, not for me.
Okay, I'm gonna have you rest your head all the way back. Jamie, can we help? I think we wanna move that headrest a little more forward, and then a little more forward or backward. How's that for you?
That seems fine.
Okay, good. We'll lock it in. So for our physicians and students that are watching, I like to do the HIBA cleanse, so a little HIBA cleanse on here. It's very rare that someone would get an infection or something like this, but we still do the little cleanse. We talked about the hyaluronic acid versus using the permanent filler, the Bella filler, and I've done it both ways, and so Ryan opted today. He wants to use the hyaluronic acid just to see how it looks. We can always add more later, and the hyaluronic acid is also reversible, so it can be dissolved away if needed, although I've never had to do that for filler rhinoplasty. So I'm going to start numbing, and I like to numb around the nose, and I found under the lip is a nice place to just do a little bit of numbing. So what I'm going to do is I'm going to lift your lip here. You'll feel this little buzzer, and you feel buzz, and then you feel a pinch on 3 here, 1, 2, 3, pinch. You feel small, medium, big pinch. What do you feel there? Not too bad? Very small. Okay, good. Good with sign language here. That's good. All right. I'm not in a hurry. If you need a break, you let me know. So what I do, this is right near the anterior nasal spine. You feel small, medium, big pinch. Not too bad? Okay, good. If you need a break, just let me know. You might feel a little pinch, but when we numb here, it makes everything much easier. Doing okay? He's tough. We try and make it easier than getting a tattoo or easier than going to the dentist. How about there, small, medium, big pinch? Not too bad. A little bit there. So it's sensitive, so I try and go slow, but once it starts numbing, and it's much, much more comfortable. How about here, small, medium, big pinch? Very little. Okay, good. Very good. So we're not in a hurry. We take our time. We focus on the local anesthesia, office-based procedures, and we guarantee that patients look natural. Typically, our filler rhinoplasty patients, we expect that they're going to pass the grocery store test the same day. You walk into the grocery, nobody does a double take. How about here, small, medium, big pinch? Not a little bit, just a little, okay. We take our time. Now, numbing here does change the nasal anatomy a little bit, but still we're able to accommodate for, can I have some gauze, please, Jim? I'm just gonna press on this area here. Is that tender when I push or not really?
Not really.
It's gonna feel pretty goofy. But this is just the numbing medicine part. I like to do the filler rhinoplasty from both the bottom and from the top. So now I'm gonna lift, and then over here, do you feel small, medium, big pinch or not too bad?
Not too bad.
Now I'm numbing closer to the lateral nasal ala. I'm going to do the same on this side because there's a very rich nerve distribution. How about here, small, medium, big pinch, a little bit there. You see he feels it, and then I'm going to let that settle. You should feel that start to ease up just a little bit. Now, how about here, small, medium, big pinch? Not too bad, a little bit. So we're right near the columella and the nasal septum. Small, medium, big pinch there, not too bad. A little bit. Okay, so now we're gonna press, hold some pressure. And then, do you feel a little bit of a pinch here? Small, medium, big, what do you feel there? Not too bad?
Medium.
Medium, okay. How about here, small, medium, big pinch? A little bit, okay. We take our time. The main work we're going to be doing is along the bridge of the nose, the dorsum, so where we're working here. Sometimes I will do columella injections with the HA, and you can still do that, but comfort is tantamount. Comfort is really important. So what I'm going to do now So I'm just gonna hold a little bit of pressure. Is that tender when I do that or not really? Okay. So I'm just reducing some of the swelling from the numbing medicine. Filler rhinoplasty is an advanced technique, and I've had years and years of surgical training, so you're not going to get the same recommendations and the same results from people who don't have surgical rhinoplasty results. A lot of people doing filler rhinoplasty out there, and you never know when you're getting a beginner. So, you know, they have those bumper stickers that say caution beginning driver. They don't have those for, injectors, so you need to make sure you're going to someone who's experienced and board certified. Let me have you rest your head all the way back for me, please. Okay, so I like to do some in the nasal dorsum here as well, so you'll feel just a little pinch here. 1, 2, 3, pinch, a little pinch there, sorry. You doing okay?
Mm-hmm.
And then over here, small, medium, big pinch. Not too bad, a little bit. So the numbing medicine is helping us because that is definitely a sensitive area. We're right in between the alar side walls. Okay, good. The medial crus of the lower lateral cartilage. Okay. You doing all right?
Yeah, I didn't feel that.
Okay, me neither.
I didn't have a sign for nothing.
Okay, good. We're good, all good. So you might feel just a little pinch here. 1, 2, 3, pinch. Little pinch. Over here, small, medium, big pinch, not too bad.
Mm-hmm.
We mix a little bit of lidocaine in with our hyaluronic acid, which makes it less viscous. It also makes it more comfortable. Feel a little pressure, and then I'm going to do a little bit of numbing here. So it's very typical that we feel there. It's predictable that he's got some of that scar tissue. You feel pressure pinch here?
A little bit.
I'm going to do some of the numbing medicine, a little pinch there. So here's a little bit of the numbing. How about here, small, medium, big pinch?
A little bit.
You're going to feel that start to ease up. How about now? You feeling any pain right now?
Mm-mm.
Okay, good. The lidocaine works pretty quickly. Twist, twist, twist to advance the cannula as atraumatically as possible. Feel a little pressure, a little pinch. How about here, small, medium, big pinch?
Not much.
So we're staying right in the midline. I'm going to turn your head this way just a little bit. So we take our time. We're not in a hurry. How about here, small, medium, big pinch?
Not much.
You're going to feel that get pretty numb. And I can see exactly where my cannula is. You see where the skin blanch is. So this first round, I'm just hydrodissecting, elevating the skin soft tissue envelope. Are you feeling any pain there?
Nope.
Very good. So I'm going just a little laterally to complement where I've done some centrally. I feel that predictable scar tissue. Very normal when someone's had a previous nasal surgery. Little pinch there. Just put just a touch of filler there. Just enough, not too much. Even though I've only put a tiny little bit, I can already see a nice improvement. I really like what I see. How about here, small, medium, big pinch? Okay, good. Very good, right on track. And And thank you to my amazing team, Jamie. They put everything together so nicely, makes my life so easy. So just a little central, a little lateral on each side. This is where surgically you could do cartilage grafting. I'm just filler volumizing. How about here, small, medium, big pinch? So it definitely raises the degree of difficulty when there's that scar tissue layer, but we're perfectly achieving what we set out to do, and I'm really pleased with what I see. And you're really just injecting almost 1/100th of a cc, 2/100ths of a cc, a little bit here, a little bit there, and you're just gently adding and blending and balancing as you go. How about here, any pinching?
Mm-mm.
Very good. Perfect. Yeah, that looks good. Perfect. Thank you all for watching. Thank you for sharing. We're on a mission to stop bad plastic surgery and do things the right way. If you have questions, let us know. People need to know they have options other than surgical rhinoplasty, and that will also look natural. So I'm just defining the nasal tip here by fanning out. And in each area, literally like 1/20th of a syringe, just a little bit here and there, just enough to give that volume, and then just building on. How about here, any pinching?
Mm-mm.
Once that lidocaine sets in, it really helps. So twist, twist, twist. What I'm doing is I'm navigating. We call this the skin soft tissue envelope. So I'm putting the cannula subcutaneous. There is a nasal muscular layer called the nasal smas, the nasalis, a few different nasal muscles that animate in facial expression. So you are deep to the skin soft tissue envelope, and you are superficial to the nasal smas. Very good. I can see there's really great perfusion in the skin as we're working.
Dr. Rich, we have a question about
Yes, of
what
course,
you're
go ahead.
performing.
Yes, go ahead.
We have-
What
yep.
was the question?
We have a question about what you're doing.
Okay, so we're doing filler rhinoplasty to reshape the contour. Ryan has had some nasal surgery in the past. He's got a little bit of scar tissue, so he just wanted to get a little more projection. Felt like the scar tissue had flattened out the nose a little bit. So we are giving that volume back with filler rhinoplasty and doing our best to avoid nasal surgery for obvious reasons. The much safer to do it this way, no recovery, no downtime. Perfect. How about here, small, medium, big pinch?
Mm-mm.
Very good. Thank goodness for lidocaine. Okay, so what I'm going to do now. So every time I inject, I am just rechecking the balance. Injecting in one area makes that area a little bit bigger, so other areas by proportion are going, by comparison, are going to look a little smaller. So then I'm going back to balance. And you're just constantly reevaluating, reassessing. Add a little volume here, a little volume there. Artistry is the essence of life, and the foundation of good artistry is being present. So now I'm just lateral to the midline here, balancing in how we've raised up the dorsum, some there, and perfect.
We have a couple questions about
Yes.
how long will it last.
So we have permanent fillers. The Bellafill can be a permanent solution. No matter whose face, the nose does change over time. That's very normal. But this filler is going to last about a year or two. Some people feel it can last even longer, but I tell patients about a year or two. In the face, in a mobile area in the face, we expect the hyaluronic acid to last anywhere from 9 to 18 months. But in the nose, it's not as mobile depending on who you are and what you do. I guess maybe not for Jim Carrey, he's got a pretty mobile face, but you're gonna get about a year or two from hyaluronic acid in the nose. Hyaluronic acid absorbs water. So I'm gonna put a little bit up top. And so, have you rest right all the way back. Now let me turn your head this way a little bit. When we do the filler, it's very normal that we expect some bruising, some redness, and some swelling just from passing the cannula. That's very normal. And then the swelling's gonna settle. The hyaluronic acid absorbs some water. And so there are some changes that happen for about 30 days afterwards. So I normally will get follow-up photos at around 2 months. I tell my patients they can come to the office at any time. Of course, call us at any time. We're always on call for our patients.
We do have somebody who might be interested, and they were wondering what the cost usually runs for this.
So the filler rhinoplasty, if you're doing surgical rhinoplasty, you can pay anywhere from $15,000 to $50,000 for a surgical rhinoplasty. So depending on what you do with our team, honestly, I don't know what, I think it's in the $7,000 range. It's $6,000, $7,000 depending on what you do, depending on which filler. Let me turn your head this way just a little bit. Little pitch there or not really?
Mm-mm.
I love what I see. It's blending beautifully. Exactly what we're looking for. Very good, very good. We're located in Tampa and the Villages, Florida. Now I'm not done yet. I would say I've done a little over 2/3, but I want to show you what we've done so far. So there's a little bit of swelling, but can you see how it gives us more projection? Do you want your glasses?
Yeah.
Do you see better with your glasses?
Yeah, I do.
Yeah, let's get your glasses. Thank you, Jamie. So I like the projection. It looks natural. Now, if you're going out to do a performance, like right now, nobody's gonna know. There's a little bit of red and there's a little bit of tiny bruise, or that just may be a little bit of inflammation.
Yeah.
And that's gonna settle. So I like where we are now. I would recommend that we keep building. It's not gonna go too far. And you might see a little swelling or might see a little bump here and there. All of that fades and settle. Are you okay if we keep building?
So what would we be doing?
So the goal would be to just continue to project. So if we look at, there's your picture where we started,
Yeah.
and we compare to where you are today, it's a nice improvement. It'll just make it a little bit stronger and give you more of the result. If you're done and you want to stop, we can certainly stop, but I think if we just continue, if you like what you see in the direction we're going, I would do a little bit more, but this is an artistic decision, so what do you think?
I feel pretty good about where it's at now.
So if you're happy, we can certainly pause.
Okay.
There is some swelling. That's one of the reasons. So when I do filler rhinoplasty, immediately afterwards there is a tiny, tiny overcorrection because we know that swelling's gonna settle.
Yeah.
So if you say, okay, swelling's gonna settle, it'll be a little bit smaller, and we pause now, that's fine.
Yeah.
But are you sure? Do you want me to try just a little more, or you just want to say, you know what, I like it, let's pause for now and let the dust settle?
I would say let's let the dust settle.
Okay.
Yeah.
I'm okay with that because we did
Yeah.
over 2/3 of the syringe, so I love it. Now we're going to
Cool.
get some before and after pictures.
Great.
And was that what you were looking for to get that projection?
Yes,
Yeah.
definitely.
Yeah. It looks natural. No one's ever going to figure it out. And if you, I don't know if you guys can see, and come around to see these photos, where if you look, the shape of his nose, it was almost pointing down.
Mm-hmm.
And if you see that on both sides, he was kind of almost giving it a little bit of a hooked appearance.
Yeah.
Now, if you look, I'm going to turn your head this way. He's got a straighter projection and feels very natural. There's no vascular compromise at all. I put a little bit on top just to balance because we lifted him up here. He's got the bony cartilaginous junction. So I love that, and wonderful. All right,
Great.
very
Thank
good.
you so much.
Yep.